Hello everyone, my name is Dr. Chinwe. I'm a dentist based in London, and today I'd like to address the most common questions and doubts that I get as a dentist. A sentence I commonly hear from people is flossing makes my gums bleed. And I think if I had a penny for every time I heard that statement, I'd definitely be rich by now. Let's go back to the basics. Flossing does not cause bleeding gums, okay? Bleeding gums is a sign of gum disease. So we have what we call gum health and we have what we call gum disease. And there's that transition from gum health to gum disease when people unfortunately are unable to keep up with, very excellent standards of oral hygiene, hence causing the gums to bleed, which is a result of inflamed tissues. In fact, bleeding gums is definitely 100% a sign of gum disease. And I really don't know what it is. I find that people tend to ignore the oral cavity, the mouth. Anything that's happening in the mouth doesn't seem to be much of a big deal. Because we all know, for example, if someone had, for example, bleeding on the skin or bleeding eyes, any other organ, bleeding, or even, for example, a brain bleed, which is very, very obviously, not trying to compare both of them, but very serious, they would address that straight away. But people just seem to ignore the bleeding of the gums. So I'm just here to remind you and to just advise, if you ever notice that your gums are bleeding, please do see your dentist. And as I've said, the floss is not the cause of the bleeding gums. It's just that the floss is running along inflamed tissue, and that's what caused the gums to bleed. Just to let you know as well, when you do have bleeding gums, as I've said, this is automatically characterized as gum disease. Gum disease itself can then be divided into what we call reversible gum disease and irreversible gum disease. And I'm happy to let you know that most people sit on the reversible side. So it's very important to see your dentist or your hygienist for a full assessment to know what kind of gum disease you have. And the good news, as I've said, the name is reversible, is that if you see your dentist or any dental professional to help you, with the reversible gum disease, your gums can go back to being nice and pink, like they were before. And you can actually go about your oral hygiene on a daily basis without having the bleeding gums. If you do find out that you are already going towards the irreversible stage of the disease, do not worry, it can definitely be managed. But the most important thing is getting a correct diagnosis and sticking to flossing. Flossing, in fact, does bring about a lot of benefits because with a normal toothbrush, be it an electric toothbrush or a manual toothbrush, it's actually very impossible to go in between the teeth. So flossing, either by using a tape or what we call interdental brushes, which have bristles, they could be rubber bristles or plastic bristles, are very, very important. And they're able to actually dislodge the plaque that gets stuck in between the teeth. And with that, I do not mean you have to be an expert in flossing, but it's just important to take on that responsibility of flossing at least once a day. And we do recommend at night before you go to bed. No matter how good we are at brushing and flossing our teeth, bugs and bacteria will always still be able to hide in nooks and crannies. And that's the reason why we say visit your dentist regularly, visit your hygienist regularly, because in those nooks and crannies, that wherever you're not able to reach, then professionally with our instruments, we can take care of that for you, meaning that you never slide from the stage of reversible gum disease into that of irreversible gum disease. I hope this information has been helpful, and I hope it reminds you to go get a check with your dentist or your hygienist, and please remember to floss.